here's some more things I do and don't care about as a pediatric psychologist. Number one, don't really care if you're using coping skills or coping strategies. What we really want to prioritize is the ability to, one, notice that something's wrong, whether emotionally or physically. So notice the physical symptoms of the emotions, and to notice it and be able to ensure you are still in control of your behaviors, right? So just because you're angry doesn't mean you get to punch someone, right? And that's kind of where the coping skills come in. It's more so to regulate yourself when you're having these experiences. So no, you don't need to journal every single day, but you do need to be able to notice your emotions and learn how to navigate them. I don't really care if sometimes you slip up as a parent and maybe yell at your kids. As long as it's not constant and as long as it's not verbally abusive, happens to the best of us. What I do care about is if you are allowing your child to avoid and skip the things that they're nervous about, especially if it's something like school or another important activity for their life. We know that avoidance leads to further anxiety and perpetuates the cycle until they are scared to leave the house. I don't necessarily care that you do a really intense workout every day. The goal is to move your body at least a little bit every day. We're not meant to be sedentary. We need to get out of the office, get out of the house, walk around, move our body. Doesn't really matter what you're doing as long as a little bit of movement every day. Also, as I've gotten older / further in my career, I honestly care a lot less about the modality of therapy that you're getting, as long as you have a strong and trustworthy bond with your therapist. Yes, there are some modalities that have higher evidence behind them, and that's great. However, we know that the biggest predictor of kind of positive change in therapy or a positive experience in therapy is actually the therapeutic relationship. So I would prioritize that over, the type of therapy your provider is providing.